Hello, my name is Dr. Brian Raid and I'm a naturopathic doctor, and this is a video about low-dose immunotherapy. And a fellow naturopathic doctor posted a question on one of my recent videos about low-dose immunotherapy, and it's a really good question. So the question, I'm paraphrasing a little bit here, so hopefully I'm capturing the essence of that question, but the question was, are patients who if there's a patient who has a hypersensitivity to a microorganism, and that's what's causing their chronic symptoms to persist, or them to keep relapsing whenever they come off of their antimicrobials that they're working with to kind of keep that microorganism under wraps, is that more likely to appear in patients who are suffering from other types of sensitivities or allergies? So, or to distill it down into a less verbose question, which I just made more verbose, is LDI more likely to be applicable, low-dose immunotherapy likely to be more applicable to patients who have other allergies or sensitivities? And in my experience, the answer is a resounding yes. You certainly don't need to have allergies or other sensitivities for LDI to apply to a case, but it is certainly much higher on my radar if a patient has other allergies or sensitivities. When I'm going through an intake form, and especially for patients who have already been around the block several times with treatments, they've been working with other doctors, they've traveled to different clinics, this, that, and the other thing, and they're still having persisting symptoms, then I'm always, my ears are perked and my eyes are peeled for looking to see if they do have any type of a hypersensitivity tendency. So if I see like, oh yeah, they've had allergies since they were a kid, and they're sensitive to this, that, and the other thing, and they're sensitive to chemicals and all that, what does that mean? Like from a bird's eye view, well, their immune system is just really, really hyperreactive to things. And so if their immune system's hyperreactive to those known things, then what else are they hyperreactive to or hypersensitive to that we're not aware of already? And it might be microorganisms or hormones or neurotransmitters or whatever it happens to be. So yeah, absolutely, if the patient already has sort of an allergic terrain, as we might say, in the naturopathic or integrated medical field, then much more likely, or it raises the likelihood that there might be some response to low-dose immunotherapy. So since that's the answer to to that question. And just as a little bit of bonus info, just recently had a report from a patient who I've been treating for several months now, doing a lot better, addressing or working on the patient has POTS, which is postural orthostatic tachycardia syndrome, has some chronic viral issues, had small intestinal bacterial overgrowth, which I think we've got on top of in large part, has some other some signs and symptoms of mitochondrial dysfunction, has some dysmenorrhea, other menstrual cycle related issues, a lot of fatigue, a lot of exercise intolerance, and a lot of things have been getting better, but it's been a little bit slow going, kind of getting each piece of the puzzle in place going along, a couple of flare-ups along the way, maybe pushing things a little too fast inadvertently. So I started this patient on some low-dose immunotherapy for Borrelia, and which is a bacteria that causes Lyme, for anyone who doesn't know. And the patient started on the first dose, starting with a low dose and gradually increasing the low dose immunotherapy, and is already experiencing a 25% improvement in energy and endurance and reduced body pains and different things like that. So anyways, just a little anecdotal clinical anecdote there, just in real time, just got that update from the patient as I was checking my emails before heading home for the day, and happy to see that news. So just a really nice little tidbit, or a nice little clinical example of someone who's got a lot of the pieces of the puzzle in place, has lots of health issues going on, is doing better, and it probably, if the patient is already maybe like 30% improved, maybe 35% improved from baseline with all that work we've done, and now there's been an additional 25% jump in the right direction just from the right dose of low-dose immunotherapy. So it's one of the many reasons that I love this therapy, and just wanted to share that. So I hope that this answered the question, and if there's any other questions about this topic or anything else, just post it in the comment section below, and I will do my best to answer it.